I'm here with Dr. Stephen Mandel and Sam Mandel. Dr. Stephen Mandel, you, of course, are the president and founder of Ketamine Clinics Los Angeles. And Sam Mandel, you are the CEO and co-founder of Ketamine Clinics Los Angeles. I want to thank you both for taking the time to join us on relatively short notice, but great to have you both here with us.
Thank you.
Yeah, thanks for having us, David.
Yeah, absolutely. Unfortunately, it's not under, the best of circumstances with, the news that's come out recently surrounding the untimely passing, of course, of actor Matthew Perry and the release of the autopsy report associated with his death coming out this past Friday. Unfortunately, that's created a swirl of misinformation and speculation across the media and social media, as in the autopsy report. It was determined that his passing was due to acute ketamine acute effects of ketamine within his system. And so we certainly want to take this opportunity to, shed some light on the situation and provide as much information and facts surrounding ketamine, and more specifically, ketamine therapy. Because what I was seeing as I was going through a lot of the comments in social media and out there is there's still very much a stigma tied to ketamine. People still look at it as being nothing more than a recreational party drug. And not a lot of people out there actually understand how and why it's being utilized as a very effective therapeutic option for individuals suffering from very serious mental and physical health conditions, such as treatment-resistant depression, anxiety, and even chronic pain. So we want to help bring all of that to light here. So I want to start with you, Dr. Mandel. Talk to us a little bit first about let's help folks out there understand what are some of the risk factors and dangers in terms of using ketamine recreationally and not under the guidance and supervision of a qualified physician.
Okay, thank you. Let me step back a moment and just say my condolences to those who were for whom Matthew was near and dear. He had a very, very wide following, and actually a lot of relatively intimate connections, and I'm sure they're suffering, and my condolences to them. I'm sorry for his passing. He died of a number of factors. One of them was excess ketamine in his body, and that alarms a lot of people seeking treatment with this amazingly effective, safe, fast, cheap drug. Mm-hmm. What happened with Matthew, I can't tell you specifically. I can tell you the coroner's report says he had a general anesthetic level of ketamine in his body when he died. We give less than 1/10 of that in the clinic. Our patients are awake. What happened to Mr. Perry has nothing whatsoever to do with the treatment of mood disorders with ketamine, any more than a unfortunate person who downs a fifth of vodka and suffers alcohol poisoning has anything to do with someone having a cocktail. They're unrelated. The molecule's the same, the circumstances, the route of administration, the intent is totally different. This is a drug that we give, it's a controlled substance for a reason. Sam has a great analogy. I'll let him tell it about flying an airplane. Go ahead, Sam.
Well, I would also just add that, in addition to the quantity of the ketamine that was involved in this case, it was also in combination with an opioid and a benzodiazepine, both powerful sedatives that are dangerous when combined, just the two of them without ketamine, let alone with the addition of ketamine, and while alone in a hot tub. And it's quite clear that he died by drowning. And, there was all of these various factors were contributing factors, but it wasn't necessarily any one of them that was the real cause of death, including the amount of ketamine, despite the fact that it was a pretty extraordinary amount for someone to be taken by themselves in an unsupervised manner. And there's zero correlation between that and the therapeutic clinical use of ketamine for mental health. And, the analogy that Dr. Mandel was mentioning is, when someone takes this is kind of like someone saying that planes are dangerous because someone took an airplane and flew it and crashed it and died with no prior training or knowledge of how to fly airplanes. And that's just a very silly kind of conclusion to come to. In reality, planes are actually very safe when a licensed, experienced pilot is at the controls. And, otherwise they can be treacherous. So that's, I guess, one way that I kind of thought was useful to think about it in terms of some of the distinctions between the way that Mr. Perry used ketamine and the way that ketamine is used in a therapeutic context.
Absolutely. And, Dr. Mandel, I want to also echo your sentiments at the top here with, our thoughts and condolences certainly do go out to the friends and family of Mr. Perry. Unfortunately, with him being a celebrity and high profile individual, much of his private life has been put out into the public and into the spotlight. One of those things, of course, has been his longstanding battle with addiction and depression. And one of the things that's been discussed a lot here in the past few days is the fact that he had been receiving ketamine infusion therapy. And I want to add some context here and certainly, get some clarification. How long does ketamine actually stay in the system? Because where I'm going with this, just to, be very straight to the point, is it's not possible. If his last ketamine infusion therapy was in fact a week prior to his passing as what's been reported, then that would have nothing to do necessarily with what actually happened on the day of his death, right?
You're correct, David. The ketamine that Matthew received the week before had nothing whatsoever to do with his passing. Zero. And in fact, ketamine stays in the system between 2 and 3 hours. This was more than a week after.
Yeah, and I'm troubled by that coming out in the report because the coroner even goes on to mention that there was no real correlation between the two, but just the mention of it has raised a lot of concern about that and making people wonder, well, is there some sort of a connection there, and what does that mean, and could it have had some sort of an effect? It's just not possible, yet it hasn't kept people from becoming alarmed at what it might mean for their health and safety to have ketamine infusions.
Yeah.
He was actually getting treatment for ketamine because of issues with substance abuse and with depression. And I'm not an expert on Matthew Perry,
Right.
And we're not talking about him as a patient,
Right.
But as a very public figure who, it's one of the stories, and I don't want to divert from your story, David, but one of the stories here is this is a guy who really got the brass ring or the gold ring. This is the guy who hit the jackpot. He had more money than any of us could count. He was loved by millions, literally. He was relatively young. He was good looking. He was in relatively good health. I mean, really, this is the American dream. And this man is alone in a hot tub taking anesthetic levels of medicines, plural, and passing away. This is a real tragedy. And it's not really about ketamine, although I'm happy to talk about ketamine.
Yeah, absolutely. And, I think it's important to talk about it because despite the fact that his death, may have been caused by multiple factors here, still trying to help people understand exactly what ketamine therapy is, specifically ketamine infusion therapy and ketamine assisted therapy is super, super important here. And so I want to talk a little bit about how specifically and why ketamine is so effective in treating individuals suffering from certain conditions such as treatment-resistant depression, anxiety, addiction, chronic pain. Dr. Mandel, if you can help shed some light on what specifically makes ketamine an effective treatment option for these conditions.
The first and foremost is that ketamine activates. One of the things that happens with depression is that people become withdrawn, low energy, do not get pleasure from anything, and have great difficulty in focusing, in concentrating, and in taking action. Ketamine activates. It doesn't necessarily provide direction, which is why you need the ketamine plus the care. Ketamine by itself, this is closed course professional driver. This is not to be done at home. in a hot tub or not in a hot tub. This is not for self-care, but as part of a treatment program. The ketamine activates the depressed, the suicidal, the people triggered by some of the symptoms of PTSD, and enables them to focus, to concentrate, and to have the energy and the hope. It restores hope to begin to chip away at the siloing and the self-deprecation and the bullying self-judgments that they're making about themselves that are keeping them from living their full lives.
Yeah, I think it's important to understand that one of the things that makes ketamine unique is the really two-pronged approach that it has in tackling mental health issues. And that's really the neurochemical effects, what's going on in the brain chemistry during the infusions, and the changes that happen during the infusions that persist long after the medicine has left the body. And then also the psychological component, right? The experiential side of things, that kind of dissociative or really psychedelic experience of the ketamine. And those are both hugely therapeutic for people. You know, on the neurochemical side, it has a totally different mechanism of action than our, conventional antidepressant medications that make it unique, that make it effective when nothing else is. Things like it being an NMDA receptor antagonist, an increase in the neurotransmitter glutamate, helping to increase BDNF, brain-derived neurotropic factor, proteins that can help to increase neurogenesis, new neural pathways forming in the brain. So there's meaningful changes going on in the brain, not just covering symptoms, that are helping people to get better and have better brain function and have better mood as a result. And then on the experiential side of things, people are able to go back into past trauma in their lives and to sort through it and gain insight and perspective and new understanding of what's happened in their lives that help them to have closure around things that maybe have been suppressed or they've had very negative and dark stories about and unable to really work through. So it's a really powerful medicine when it's used responsibly in the right setting.
Yeah, when we talk about using it responsibly and in the right setting, let's also talk about the element of psychotherapy and just other sorts of integration support resources. This isn't just, the ketamine itself is going to do everything for you. There's a lot of other factors. Can you share with us what some of those other factors are?
It's the ketamine plus the care. And the care is, we have a 5-pronged approach in our clinic, and that's good sleep hygiene, good nutrition, exercise, an intimate interpersonal relationship with a peer, and talking therapy. Now, a lot of people who are depressed know about all that stuff, but they're too poop to pop. They just can't. People know that if they exercise, they're going to feel better. People know that if they eat right, they're going to feel better. People know that if they get a decent night's sleep during the appropriate light-dark cycle, without substances and without devices, it's going to work for them, but they can't do it. And the ketamine empowers them to take those actions. Not the ketamine, but the ketamine plus the care. And self-care with ketamine is as much of a crapshoot as self-care with any potent substance. Some people might benefit, but it's a high-risk activity.
And Sam, I want to get your thoughts on this because we know over the last few years, ketamine assisted therapy has, somewhat taken off here across the US. We've seen multiple clinics open up. With that, that's great from an accessibility standpoint, but then there's also the concern over quality standards and safety and responsibility. Talk to us a little bit about what KCLA does specifically to stand out and really set the gold standard for safety, responsibility, and efficacy when it comes to ketamine infusion therapy.
Yeah, that's a great question because there's huge variability among ketamine clinics. And so even when we talk about having ketamine in a kind of clinical setting, there's definitely still some issues with safety there, right? And it really needs to be at a reputable place. So some of the things that we've done that we feel are really the best way of doing this, the kind of gold standard, as you put it, are to use hospital grade monitoring equipment. We monitor patients' vital signs like their pulse rate, their oxygen saturation, blood pressure, and EKG. and their respiratory rate during their infusions, real-time continuous monitoring. We have a diverse team of clinical professionals who are there, doctors, psych NPs, nurses, who work collaboratively as a team to have direct observation of patients during their infusions to not only keep them safe, but also comfortable during their experience. In addition to their credentials, all of our providers go through additional training, things like basic life support, which is BLS, advanced cardiac life support, ACLS, and also moderate sedation training from the American Society of Anesthesiologists, the ASA. This is all really extensive training beyond what their typical training would include. And again, this is all really just to ensure that patients are safe and comfortable at all times. And we take it very seriously, and we're very fortunate. And knock on wood, we've had no bad outcomes, zero. We've provided over 30,000 infusions over the last decade, and there's been no bad outcomes. I was actually just looking at another study that was saying with over 70,000 administrations and a meta-analysis, they found no bad outcomes. So I mean, this is really a very, very safe medicine, extremely safe in a wide variety of contexts when it's used by professional clinicians responsibly. And this is such a what happened here in this tragic case is such a tremendous deviation from that.
Yeah, it really is. And one thing I want to get a comment on, possibly from you, Dr. Mandel, is, one of the comments that stood out for me that I found was someone saying, why was he using ketamine infusion therapy? Trying to treat drug addiction with drugs. How does that work? Can you shed some light on being able to utilize and leverage the power of ketamine infusion therapy to help an individual struggling and suffering through substance abuse addiction?
Well, yes, we use ketamine primarily for mood disorders in our clinic. Mm-hmm. And it's been used that way by us and others since the late 90s. But in the 80s, the original use of ketamine outside of the operating room, you remember, ketamine was originally approved by the FDA as an anesthetic for human beings in 1970. Mm-hmm. It's been around a while. It's been given literally billions of times. But ketamine for behavioral use was originally used for alcohol addiction. It was used in falling down drunk patients to help them to withdraw from alcohol addiction. And in the most dire circumstances, in the 1980s Moscow, they had better than a 50% success rate, success being a year plus of abstinence from alcohol. This is pretty amazing. Now, we use ketamine for help with opiate withdrawal and also alcohol, but principally not withdrawal, but to sustain avoidance. Ketamine really helps big time with managing the cravings. Ketamine gives you that pause between the impulse and pulling the trigger. And excuse me just a second, Sam. You asked, why are you using a drug that can be abused to help people? Why do we use morphine to relieve pain when it can be overdosed on? Why do we use alcohol as a social lubricant when people die from liver disease and automobile wrecks all the time? It's a matter of who's using it for what purpose. What's the context? What are you attempting to achieve?
I would also just add with substance use, obviously, if somebody has a ketamine habit, probably not a great treatment for them. But for virtually all other substance use disorders, whatever the substance, might be, that is the drug of choice, if you will, or the drugs of choice, ketamine's great, not only at curbing the cravings, but also getting at those underlying issues, because something that is so often overlooked is that really substance use disorders are really largely symptoms of other conditions. People are using drugs and alcohol to numb, to deal with pain, right? They're dealing with really severe anxiety. They don't want to feel. They're trying to take that edge off. They're dealing with terrible PTSD and night terrors, and they feel like they need to numb themselves out. They're dealing with depression. They feel so awful. They just want to feel good. So this is largely why people use substances or misuse substances. And ketamine can help to treat those underlying issues, those conditions that are driving people to feel the need to numb. So it's really beneficial in that way as well. I just wanted to point out, and
Yeah.
they don't feel the need to use these other substances as much when they feel good.
Let me throw out, in addition to that really good summary of all the substances, of all the symptoms, people who use substances are often suffering from obsessions or compulsions. Ketamine can help deal with obsessions and compulsions, not only for opiates and alcohol and other agents, but we have had good success with eating disorders. Now, it isn't as effective as it is for mood disorders, but we have an 83% success rate for mood disorders. That's a pretty high bar, but it's very effective for helping people to control their cravings for substances and other obsessions and compulsions.
Yeah, and we're talking about relief for real people out there. I think that's what's important. You know, Sam, I saw you out in Denver earlier this year at the Psychedelic Science Conference that MAPS put on, and you were there with a patient of KCLA, and her story was incredibly profound and inspiring. I mean, you could just see the happiness and, you know, just the joy within her. And so I just, want to leave everyone here with, some last thoughts on why it's important to not, forget everything what's happening here with ketamine assisted therapy and ketamine infusion therapy and the real people that this is having a very positive impact on. You just share maybe a story or two of someone that has come to you in very, very desperate need of help and relief, and you've been able to provide them with that.
Yeah, you want me to jump in, or were you gonna? Okay.
Yeah.
So by the way, I texted her today because there was another media inquiry and they wanted to speak with a patient. She's told me she just got out of the ocean and was thinking about us and how grateful she was that she was happy and enjoying a dip in the ocean, which is something she would not have felt comfortable doing just a few years ago. So yeah, I mean, this is why we do this work. It's just beyond gratifying to help to really transform people's lives. And, we see people who have had 10, 20, 30 years of treatment-resistant depression and not benefited from anything else out there. And in the case of the patient that you're referring to, she had tried all the medications out there, had several rounds of ECT, electroconvulsive therapy, shock treatment. Many people have tried that, and then also even sometimes TMS as well, and not benefited or only gotten a very minimal benefit. And after having infusions, they are happy again. They're not just middle of the road able to function and muscle through the day, but they're actually getting a restoration of pleasure and enjoying their lives. They're becoming good mothers again, good husbands, good partners, good sons and daughters, and active contributing employees within their companies and members of their community. This ripple effect is of positivity is huge. When somebody passes away suddenly, or they complete suicide, or there's a loss or an overdose, that is a ripple effect of negativity that can affect generations, right? And in the same token, though, we can do exponential good with one person. There's this saying we love, to save a life is to save the whole world. One person getting their life out of this can just change so many other lives and touch so many other lives in their world and have an exponential impact. So it's really meaningful work. And I hope that people can understand some of the nuances of just how valuable this treatment is, how badly it is needed today, how badly we need real solutions to the mental health crisis, and that we not unfairly demonize it when it's not used responsibly and there's a bad outcome.
Absolutely. Sam Mandel, Dr. Stephen Mandel, thank you so much. I really do appreciate this. And then we'll make sure we get KCLA's information linked into all this. I want to encourage everyone, please check them out, especially if you're in the Southern California area. Even if you're not, please check them out, because they truly are, at least in my opinion, the gold standard for ketamine infusion therapy clinics. So gentlemen, thank you so much again for taking the time to do this. We really appreciate it.
Thank you.
Yeah, thanks for having us, David. Thank you for doing what you're doing.
Appreciate it. Thank you.